So today we have the pleasure of
Mhm.
meeting with Gabi Rosenwald. She is in the Doctor of Audiology program at University of Kansas Medical Center. Hi, Gabi. How are you?
I'm good. How are you?
Doing well. Thank you for coming on today and coming in to talk about kind of why audiology and the ins and outs of a doctoral student. So let's talk a little bit about what you're currently doing. You're currently a newborn hearing screener tech at Truman. Is that correct?
Yes.
Okay. So when somebody has a baby, they get their ears, the baby's ears get checked, and what all goes into that process?
So, as a newborn hearing screener, you can technically start screening someone's hearing about 8 hours after they're born.
Okay.
So, I handle like the really tiny babies, the fresh babies, I like to call them. And so, basically, what we do is we use what's called an ADR to record the responses of a baby responding to sound. Obviously, a baby can't tell you, yes, I heard that. So we put sensors on their head and it basically locates a spot on their brainstem. And then it shows us whether or not they can hear that sound. And we just retest it until they either pass the test or they need to retest. And then we'll schedule them to get another screening done in 2 weeks or so.
Okay. So at Truman, how many babies are you or fresh babies are you looking at throughout a day or a week?
So I work 3 times a week at Truman Centers usually, and I would like every baby is or all the days there's different amounts of babies. So when I come, I would say there's usually like an average of like 4 to 6 babies for me at least. Other people could say otherwise. And right now we're getting a baby boom, so there's been a lot of babies in the hospital. So I would say most days I come in, there's like 7 to 9 babies or so.
That's cool. So you're in the program for Doctor of Audiology at KU Med. How did you get involved in audiology to begin with?
That's a great question. A lot of people go into either speech language pathology or audiology because they know someone within the hard of hearing community or they were just always interested in it. I kind of got into it in more of a haphazard way. It was more of like an accident. When I came straight out of high school, I had no idea what I wanted to do with my life, but I was really interested in brains. So I decided to major in psychology. And for one of the general requirements, I took a linguistics course where they talked
Right.
about psychoacoustics and basically how your brain processes how someone's talking. And that really interested me. So I went and took a physics of sound class at KU, and they were talking about like wavelengths and how wave hits your ear and then it's transduced through the system and how your brain processes it at like the really small cell level. And the teacher was like, if you enjoyed this material over the past month, you should probably go into audiology. And I was like, wow, all right, that was a sign right there. So I decided right then and there to start doing audiology, and I have been an audiology person ever since.
That's awesome. So that was at the University of Kansas in Lawrence.
Yes, it was.
Okay. And now you're continuing that education through KU Med.
Exactly. I apparently love KU, so
I'm right there with you. So while you were at KU, you were a graduate assistant and teaching in the audiology lab for
Mhm.
undergraduates. What does that process look like as far as becoming a grad assistant and what you did on a daily basis in that role?
So I am still the graduate teaching assistant for that undergrad course. What that looks like is so I'm the GTA for the Intro to Audiology class for the undergraduates who are kind of either going into speech language pathology and have to take the course or might be interested in audiology. So I set up all the labs and I every Friday I do the labs with the students. I answer questions that they might have about audiology or the topics that are covered within the class. And then I just, I'm there as a support system for my professor that I work with.
Right. Cool. And then internships that you did, I think you had two different internships during your program. What were those and how did you become interested in those specific internships?
Yeah, so the first internship I did was actually not affiliated with KU. I actually sought it out myself because I was kind of getting into audiology and I wasn't quite sure, what it entailed. And I didn't want to get too far into my career path before realizing, oh, wait, this might not be for me. So I emailed a few different audiologists in Lawrence and I was just like, hey, I would love to just watch you do what you do. And then one of them emailed me back and said, please join us as an intern. So I interned there and I worked as like a receptionist slash someone to clean people's hearing aids and check them, see if there's something that we had to repair ourselves in house or send out. And then the second internship I did, I was a clinical practicum student at the University of Kansas. And there I just basically followed my preceptor around and I helped her clean hearing aids, helped fix those, and I also just accompanied her to different evaluations.
Okay, cool. So as a doctoral student, you're working
Mhm.
as a newborn hearing screener and you're working as a grad assistant. How do you have time for your actual schooling?
Um, Good question. I'm still kind of figuring it out. Grad school is definitely a time where you learn a lot about time management. I've always thought I've been pretty good at time management, but I'm still learning to this day. Um, Basically, school always comes first. No matter what you're doing, school is going to be the number one. So I'm not going to pick up more shifts as a newborn hearing screener unless I know that I can get everything done with my schoolwork. And with my graduate teaching assistant, I get all of the things I know that the students need to progress in their week and in their semester. But at the end of the day, I value myself and my education a lot. I think KU gives me a lot of opportunities, and it would be a little ridiculous of me not to take advantage of all of those. So I definitely put school first.
Okay. So as an audiologist working in the newborn, a typical week of a student, grad intern, and a somebody that's working 3 days a week. What does that kind of breakout look like as a doctoral student?
So week by week, it's very busy, and it's definitely a little different than maybe someone a year older than me, just because I have had my entire grad program thus far with COVID. So I've had a lot of my classes be online, but thankfully we are moving more towards being in person. So I would say starting like 3 weeks ago up until now, I would say I go into the clinic about 3 days a week to do assignments, to make up any assignments that I didn't finish while I was there, and for classwork. And then about 2 days a week, I have hardcore classes where I just show up, I listen, I take notes, I do all of those things. And then I would say after I do clinics, I usually use that time to do all of my homework. So I spend 3 hardcore days doing homework, and then I'll like finish up the work in between instead. Thursdays, Fridays are complete work days for me, and then I work every Saturday and Sunday morning. And then for my me time, I usually spend that on my Mondays and my Saturday nights. So
Okay. Yeah, that's awesome. So you're looking at graduating in 2024 with your doctoral audiology. As of now, what type of audiologist are you looking at wanting to be, or what different path options are available for that?
it's a great question. So as of now, I don't have too much experience dipping my toes in every single category, but the reason why I really thought audiology spoke to me was because I could apply not only the science of how the system itself works in your body, but I could also apply that into a clinical practice to be able to help someone else. And that really speaks to me. I really want to be able to help someone with their what they see as a problem or help work through a situation and counsel them and communicate different ways that they can change or improve or just have a different like lifestyle that they'd like for themselves. So i I would really like to be a clinical audiologist and really work with the patients and see them every day, hear about their what they really want to resolve, and what they're having difficulties with. And I would love to fit hearing aids. I would love to do maybe some work with vestibular disorders or balance disorders. I have a sister with Meniere's, so I would love to be able to help her in a way that no other doctor can.
Right. So in our emails prior to our meeting, we kind of talked about my adventures with audiology.
Yes.
And so for those of us that don't know, I've ruptured my eardrum 4 times, the same eardrum, and had tubes when I was little. So I remember going into the audiologist and being in the quiet room and putting the different nodes on your ears and listening to the beeping sounds. And then as well as our son we had him have tubes. And so we went in there and did the beeps and the testing and the light boxes that jump up when they click the so with that type of audiologist, what are they specifically looking for when they're doing that kind of testing, and how does that relate to, you had said the people with balance disorders?
So whenever we do audiology or evaluations, pediatric audiology is a little bit different than adult audiometry. So when we do pediatric tests, so your son coming in and he has that like play going on and the lights are flashing everywhere, we really want to rule out any other issue at hand. So if he comes in complaining of like an earache and you think he has an ear infection, he had tubes put in, we just want to, in that position, confirm that he did have an ear infection and confirm that there's nothing else that could possibly be going wrong. In that situation, we also want to be able to rule out who we might need to refer out to. Audiologists work a lot with speech language pathologists. So if we notice that he's having some grammar issues, we might say, okay, we should probably refer to a speech language pathologist to work on his language development. So those are some things that we're looking for. Whereas adults, if you came in as an adult and you had an ear infection, we again would be confirming the presence of the ear infection and making sure it's not anything else. A lot of audiology is putting puzzle pieces together and saying, if not this, then what? So that's a lot of what we do. And so for adults, that's probably what we focus on, as well as regaining or meeting the standard that they had before. So kids are usually going to complain of like earaches or just not being able to hear their teachers, whereas an adult might say, I can't hear as well as I could. So we just try to see where they are and see how close we can get them to that point again.
Okay, yeah. So dealing with that, after you do the testing, what other team members are there that deal with audiologists? Like we talked about the surgeon that repaired my eardrum, you would deal with him, and who else do you guys communicate with on a daily or weekly basis?
So audiologists can work with literally any kind of professional. We work with educators in schools. A lot of schools have an audiologist on hand.
Okay.
We can work with speech language pathologists. We work with ENTs, surgeons. We can work with psychologists about counseling matters, and we can also work in the education field ourselves as professors. And we can also work a lot with researchers to be on the team and collaborate with how research is done and what we're really looking for in research.
Cool. So in the hospital, you would deal with the doctors and nurses and tell them, if the babies can hear or if they can't hear, that kind of stuff. When you're doing your rotations, who else, in the clinical setting, I guess, do you guys deal with?
In the clinical setting, at the hospital at least, we're dealing with we'll be around the family themselves, and we will a lot of times communicate with nurses and the mom's physician to make sure like we're not doing a test at the wrong time. If a baby's in the NICU, we have a certain criteria that we can't test a baby if they're on antibiotics or something. So we just communicate a lot with the nurses and the staff members taking care of those babies to make sure that our test won't be interpreted incorrectly.
Right. Cool. So what's something you wish you knew maybe in high school or early on in college that would help you with your doctoral program now?
Huh. Let's see. Thinking back to high school me, I think I put a lot of stress on myself not knowing what to do right out of high school. I think a lot of high school, a lot of people in my experience told me that it was really important to do a lot of extracurriculars and make sure you're getting good grades so you can get into a good programs to like start your education on what you want. I would say I wish I had known to be okay with just knowing that things will happen that I won't necessarily be able to control. I found my career path completely by accident,
Right.
and I think I think I just had to be open to that experience. Whereas before, I would probably have been a little bit too anxious to see that opportunity present itself. I would definitely have participated in more extracurricular activities probably, just so I could have dipped my toes into a lot of different things. I was like part of 2 or 3 clubs in high school, but I probably would have tried out more things in high school.
That's good. Good to know. And you guys in your high school, this school district, you had access to the CAPS building at Blue Valley.
Yes.
Was that kind of open and available, or how were you guys taught about the different programs that they had offered?
Yeah. I was actually part of the CAPS program. I was in the health professions
Okay.
section of CAPS because I knew that I would probably like to be in the health profession, but I wasn't sure what. And CAPS was such a great opportunity. We learned a lot about that in like our homeroom classes. They talked about it a lot in those, and a lot of teachers would just mention it in like for whoever was your mentor or your faculty mentor, they would discuss that a lot with us and just come into class and talk about CAPS as an experience. And CAPS was like pretty new when it's like when I was in high school, they had just built it. So everyone really knew about it. It's a huge building and you can't miss it. So I kind of had that luck on my side as well.
Let's talk a little bit about your experience at CAPS then, in that health science program.
Mhm.
What were some of the courses, if you were a completer, or how many classes, years did you study over there?
Yeah, so I did it for 2 semesters,
Okay.
and I did it my senior year of high school. And what I did was it was a very general health professions class. There's a lot of caps that are really, really specific onto a different passion, I would say. But the health professions is kind of like a very general overview of what's available.
Yep.
So in that class, I learned about a lot of different health careers, what that would encompass on a day to day basis, like what kind of education you need in order to get there. And then at the end of the semester, we had a project. So a lot of the time, half of the class would be split into learning about other professions, and then half the class would be working on your capstone. And for my capstone, I, again, am very big on psychology, and I'm big on advocacy and making sure people are aware and they have accessible information to them. So I created my capstone project over the waiting room experience, and I think everyone at one point in their lives have been in the waiting room of some clinic or some hospital and really not known what's going on or like how to interpret what the doctor is saying. So I, with a group of a couple other people, made pamphlets about like what you can expect in the waiting room, how long approximately does it take to wait for specific different issues, and like if your doctor says this, how can we interpret it in different ways? Just to give them like something more than it'll be another hour. So
Yeah, and I think that actually kind of goes in hand with COVID right now, because a lot of people are apprehensive about going back to the doctor or being safe,
mhm.
or maybe if they have something they're worried about, they haven't in the last year gone in as they could have. So that's pretty interesting. What's a product that, as a grad student or future doctor of audiology, what's a product that you really like and use on a daily basis?
Okay, so I actually had no idea you were going to ask this question, but I do have the product like right next to me.
That's awesome.
So it, as grad students, we were given this product, and it's called Otosim. And it basically is a program that we have on our computers, and it's a fake ear. So we just slip it on to our desks, and then we can do otoscopy or looking into the ear. And we can like read about what that otoscopy means and what we find to be interesting about that, or what could be abnormal about the otoscopy. And so I really enjoyed using that. I use that probably more than I'm allowed to, but it's really cool. And especially since I haven't been able to be with actual patients yet,
Right.
I think I actually get more experience with different forms of otoscopy on a daily basis because of that. So putting in a plug here for Otosim.
That's awesome. Absolutely. So for student development, student groups, being a part of a doctoral program, what are some things a student in a, you're a grad assistant, you're doing your internships, you have a job. What are some other things students can look at for student development to get some more experience, in their field or becoming into a doctoral program?
I would say take advantage of the school clubs that you have, take advantage of all of the teachers, preceptors, professors that really are associated with that club. Um, Networking starts at pretty much every level of your life. And if you make connections now, they will last you a really long time. So look into different clubs. If you're not even sure if you want to go pre-med or something like audiology, or if you want to be a dentist when you grow up, find a club. They exist in your community, they exist at your schools. So definitely seek those out. And also talk to your friends. Like, friends talk about what you want to do and like what you're passionate about, but like talk to your friends about what they're interested in, how they're going to get there, and be inspired by your friends and how they're going to accomplish what they want to as well. I'm big on pumping one another up, and I definitely wouldn't be where I am without my friends and their inspiration. So
Right. What's something that you are most proud of so far in your educational program that you've accomplished?
ooh, I haven't been here too long, so I don't have very many options, but I am proud to be I was very proud to be accepted into the KU program. This past year, it was rated in the top 10 audiology schools in the country, and I do not take that lightly. I am very proud to have been accepted and to be in the program as it is. I think that in itself is an accomplishment wherever you get accepted at, no matter what phase of your education you're in. I think it's a really big deal to get accepted. So I am very proud of that. And I'm very proud to be a GTA. I was very honored when they offered me the position, and it makes me feel really great every day to be able to help someone who, I mean, I was in the exact same position as them before, and I feel like I definitely have that advantage to be able to help them and answer their questions in a way that maybe other people wouldn't have been able to.
Right. Absolutely. What's a book that you would recommend somebody that's interested in audiology read or look at, or maybe an article about audiology?
Um, so I don't read for fun a lot of the time. I will say, I read a lot of research articles. I think, if you want to maybe learn more about the audiology field or what it's like to be hard of hearing, I did watch a docu-series on Netflix called
Okay.
Deaf You, and it focuses on people at Gallaudet and their experience being hard of hearing students. And I wouldn't say that's necessarily connected too much to audiology and like the profession of audiology, but it gives new perspective onto how different individuals perceive being hard of hearing or in the deaf community. And I mean, a lot of audiologists will work with hard of hearing or deaf community members. So I think that's a really good docu-series to watch, to have like a relatable, the people in the docu-series are like 20 years old, so it's a pretty relatable age range, I'd say. And it's just a perspective change. And I would say I recommend that.
That's awesome. Yeah, that's a good one to check out. And the last question I have for you is, if you dislike blank, then becoming a audiologist is not for you.
Okay. I feel like I should know this one well because I work with a lot of people who are maybe interested in speech pathology more.
Okay.
So I would say if you don't like analyzing, then audiology might not be right for you. And I mean that in the like puzzle piece way. Like I said before, audiology is a lot about if this, then that, and really focusing, all right, on the different parts of your ear system and really figuring out what could be going wrong. If you're someone who does not enjoy deep analysis and anatomy and I guess physics, you probably wouldn't enjoy audiology. But at the same time, there's so many different things you can do with audiology. But if you are interested in working with people who are hard of hearing or maybe with some developmental delays that impact your speech or hearing development, then speech pathology would be really great for you. So that's less focusing on the analysis aspect and more about the treatment itself.
Right. Well, that's great. Thank you so much for spending your time with us today and
Of
teaching us.
course, thank you for having me.